Hello all, this is the month of April. This is Oral Cancer Awareness Month. So in this month, I would like to tell you some basic tips with which you can identify if you have any high risk lesions in your mouth. Probably this would happen to all those people who have the habit of chewing tobacco or smoking tobacco, smoking cigarettes and consuming alcohol. That no amount of alcohol or no amount of cigarette smoking is safe. As a part of this awareness month, I would like to share this video with you where I would show you what is this oral self examination or mouth self examination. So basically in this, you by yourself or you can take the help of your family member or a friend to examine inside your oral cavity, that is inside the mouth, and see if there are any harmful lesions in the mouth which requires attention of an expert. Okay, so as a part of this, the prerequisites are: first you should have a mirror, then you should have proper illumination in the room, then sanitation of the hands because you are going to put the fingers into your mouth, or if you have sterile glove. But I would say that if you have proper sanitization, that is more than enough. So let us go into the video and see how this oral self examination is done. So initially, if I turn towards the mirror, so in this I can see that I can see entire my face on both sides and my neck. So clothes should be there till the neck part and the face should be uncovered. If you have extra beard or if you have extra coverings on the face, then just for time being you can remove them. So initially try to feel any lumps on the face, any swellings on the face, any swellings in the neck on both sides. It is better to do examination one on each side. This is because sometimes some people may, if you press both the carotids at the same time, then you may faint because of vasovagal shock. Now secondly, you can see by stretching the skin. If you feel that there is loss of stretching of skin somewhere or there is puckering of the skin, that is if you feel that the skin has become like orange peel, then that is also one of the high risk feature. Then coming to examination of the oral cavity proper or the mouth proper. First try to identify if you have problem in opening your mouth, because this is known as trismus, and trismus also amounts to some bad factor or high risk predictor in having malignancy. Opening of mouth, usually it will allow 3 or 4 fingers to go inside between the upper teeth and the lower teeth. Okay, after that, if you can open your mouth and you can just put your 2 index fingers to invert your lip, upper lip and lower lip, then you can palpate, you can touch it, and if you can see that there are any firm swellings inside, or if you can see any cystic swellings inside, if there is any ulcer, it is painful, it is bleeding on touch, then it requires medical attention. Now the second thing is, you can put your fingers into your oral cavity or mouth and you can palpate the sides, or you can touch the sides of your cheek. Okay, then the tongue. You can touch the part of the tongue, you can touch the under surface of the tongue and also the floor of the mouth, which is this part. Okay, now after done with this, you are supposed to check the bone that is lodging the tooth. So this is known as alveolar ridge, and in order to palpate this area, you just try to hold the tooth and the gum with your hand and just rub it all over the area. In this way, if you find that there is any small ulcer inside or a wound inside which is bleeding, or if there are any tooth which are very loose, then that attracts some amount of medical attention and that needs to be reported to an expert. And then you have the palate, this hard bone which is present here. This is the palate and you are supposed to touch it, check whether you have any wound inside or any swelling inside. And the tip of the tongue, that is this part, the tip of the tongue, it also helps us to do the same thing which the finger does. So with the help of tongue also, you can inspect almost every part of the oral cavity. Try to protrude your tongue and put it outside. Try to feel the back side of the tongue, that is a posterior part of the tongue. Most of the times that will induce some amount of gag reflex. You may feel like vomiting, you may feel nauseous, but that is fine. So in this way you can examine the oral cavity, you can examine the face, you can examine the neck if there are any swellings inside the neck. So this is basically the examination of oral cavity self examination or mouth self examination. In this way, if you find any lesion, then it is better you report it to an expert, an oncologist. Then you can take the medication or treatment as per the required management protocols. Thank you.